My name is Lee Ullman, and I'd like to welcome you to the Red Cross Reconnection and Resiliency Training Workshop. Um, First of all, let me introduce myself. As I said, my name is Lee Ullman. I'm a licensed clinical social worker, licensed in the state of Vermont and in Wisconsin. Um, my background is this. I've never served in the military. I had a father who served in World War II and an uncle who served in Korea. Uh, I think my involvement in mental health started to come about as a result of some of the struggles that my dad had after the war. And that's where I think my initial interest in mental health began. Thereafter, I had the opportunity between 2003 and 2018. I worked at an outpatient mental health clinic, and the local VA clinic just couldn't handle the influx of people that were coming in for services. And so in many instances, they referred veterans to our outpatient mental health clinic. And there I first started working with veterans. I found it a tremendously rewarding experience. And so when I joined the Red Cross and discovered that I'd have the opportunity to further work with service members, their families, and veterans, I was really excited about it. So thank you for joining me today. I hope you enjoy this talk. I'd like to thank you, our servicemen and women, and your families for the sacrifices you make for this country. It's much appreciated. And this talk is my way, my small way, of trying to give a little back. If I were meeting with you, which would probably be the most rewarding experience for me, we'd now deal with housekeeping details. But because this is all virtual, there are no housekeeping details, so we can skip that section. What I'd like to do right now is to read a quote to you from C.S. Lewis, and I'd like you to give it just a little bit of thought. And the quote goes like this: "Mental pain is less dramatic than physical pain, but it's more common and also harder to bear. The frequent attempt to conceal mental pain increases the burden. It is easier to say, 'My tooth is aching,' than to say, 'My heart is broken.'" Now, if I were there with you in person, I'd be asking you what that quote means to you. Since I don't have that opportunity, I'll share with you what it means to me. In our world, because of some of the stigma dealing with emotional problems and everything, it's easier and people seem to get more support if they have a physical ailment or something clearly wrong with them. If somebody has a broken arm, people can see it, they can see the cast. Whereas if you're in emotional pain, many times you suffer by yourself. And it's because of the stigma society attaches to emotional problems. Many times people are discouraged from seeking help or sharing their pain. And oftentimes you hear people say things like, "Well, just pull yourself together, you can get over this," which really diminishes the struggle that many people have. So I'm going to start out by just addressing the question of what causes depression. And there are a lot of theories. There's a biochemical theory, there's a heredity theory, there's a theory related to loss. The truth probably lies in a combination of all of the above. But figuring out the causation of depression is really not that important in terms of treating depression and helping you overcome it. We used to think that if you could just think of the critical incident that caused the depression, then the depression would subside. And we know that's not the case now. We do know that certain things that servicemen and women and their families experience seem to potentiate greater problems with depression. Loss would certainly be the most prominent, but also transitions. Servicemen and women and their families, as you know, I'm not telling you anything you don't know here, go through many transitions during the course of their careers. Change in duty station, divorce, leaving the service, being discharged from the hospital. These can all potentiate stress, and these transitions it can be quite difficult for servicemen and women and their families. And like I said earlier, knowing the exact cause of the depression, usually it doesn't cure it. It's more important to be able to recognize it. Depression can develop very slowly, and you can almost think of it like, because the onset most times is not a quick kind of experience, but it's a gradual kind of thing, that many times, because of the gradual nature of the development of depression, people don't realize that they're becoming depressed. There isn't a discrete moment in time where somebody says, oh, now I'm depressed. But what they start to find is that their mood starts to gradually change, just their alertness and all kinds of other symptoms change over time. And so what we now know is that recognizing depression, being able to recognize the signs and the symptoms, is really quite important. So our goals today, like I said, are being able to recognize depression, and then being able to use some psychological, what I would call psychological first aid, to address the issues that you may be struggling with, or that your family members or people that you care about have. I'm not trying to turn anybody into a therapist today, but having that having those skills, having that psychological first aid, knowing what they are, increases your resiliency, your capacity to deal with problems. And finally, because because suicide is a depression-related issue, we're going to specifically talk about suicide, some of the myths surrounding it, and how best to address it if you're entertaining suicidal ideations, or you know somebody else who is. So learning how to talk about suicide, and also learning how to possibly recognize that in others is our final goal. So what is depression? Depression you can think of as a spectrum disorder. And when I mean spectrum, you can think of depression as being along a continuum, a range of symptoms that can go from quite mild to very severe. When we talk about quite mild, you can say that the person feels a little bit sad. Most of us in our lives, and I shouldn't even say most of us, all of us feel sad, feel blue, feel down at times. And most of us, because we're pretty resilient people, we overcome that. And it never adversely affects our functioning in life. But when it starts to affect our functioning, when the symptoms, when the number of symptoms, or the number and severity of symptoms increases, that's when we want you to be able to recognize what's going on in yourselves, and be able to address that, or at least know when to ask for help. So as I said before, there are different signs and symptoms. I think of the word signs and symptoms in this way. Symptoms are things that you're going to be able to identify yourself, things that you're feeling, things that you're experiencing. And the signs are what you see in other people. Now, the Red Cross has a handout. I don't know if you have access to it or not, but in that handout, they list 46 different signs and symptoms of depression. And as long a list as that sounds like, it's not even exhaustive. I'll mention a few of them, and I'm sure that if you reflect upon this yourself, you can come up with other symptoms and signs that I haven't even mentioned. The first and foremost, which is probably the most disturbing one, and I mention this first because it's so important, is if the person is experiencing a sense of hopelessness. Um, that is probably the most uh, serious symptom. And it's one that, if the person is entertaining suicidal thoughts, is probably the most serious symptom that they can experience. But the person can also experience difficulty concentrating or difficulty focusing. Psych jargon for those kind of terms is called dissociation. Um, in the clients that I've worked with over the years, they come in and when they talk to me, they describe it as, Lee, I just feel spacey. I just don't feel like I'm here. It's like I've got a plastic bubble over my head and I'm seeing people's mouths move, but what they're saying doesn't necessarily register with me. That's dissociation, and it's a symptom of depression. Agitation, that's another one. Anger. Many times people don't identify their depression, but they're able to identify their anger. And in many instances over the years in working with folks and working with veterans, they'd come in and they'd be very upset, very agitated, and very angry. And I might ask them, are you feeling kind of down? Is there something bothering you? And the response would be, no, damn it, I'm just angry about things. But when you had an opportunity to talk to these folks at length, that anger has become a really prominent part of their lives and prominent in their interactions with other people. So again, that's an important sign of depression. Irritability, I think I mentioned that. Sleeping too much or sleeping too little, both can be symptoms of depression. Exhaustion. Depression can physically affect us to the point where we just are wiped out. I don't have any energy. I feel depressed. Stomach problems. And the stomach problems don't just have to do with things like diarrhea, but you can also be constipated. So, both ends of the continuum. But many times people manifest their depression with physical symptoms. And it's not in your head. It's not an imagined thing. This is the way your body is reacting to feeling depressed. Difficulty making decisions. And that kind of goes back earlier to that dissociation. And finally, the one that many of us are familiar with, substance abuse. So before we talk about some of the things we can do to help yourself and to help others, let me try to explain self-awareness. Let me try to explain why self-awareness and resiliency training are so important. I'd start with the question, why is it important to learn to use the techniques for self-care? Many times we learn things and we think, if you learn something like mindfulness or you learn something like meditation or some of the other exercises that I'll talk about here, and people go, well, that's all well and good, but how's that really going to help me? It helps you learning a new skill. When you learn a new skill, whether that skill is an intellectual skill or it's a physical skill, you're training your brain. When I say training your brain, you're actually developing new neural pathways in your brain. And you're taking existing neural pathways that have already been laid down, and think of it as a path, that neural pathway. And now, because you're learning something and you're practicing it more, that pathway becomes a superhighway. So it's something that you can use and use more effectively because you practice it more. I mean, the greatest example of this is when you first try to learn any new skill, whether it's riding a bike, playing a musical instrument, weightlifting, anything that you're doing, learning a new language. It's difficult at first. We stumble at first. We don't, it doesn't go smoothly. But the more frequently that you do it, the easier it becomes. And, in the parlance in the military, they're teaching you many skills, which the term muscle memory. Okay, you know how to react because you've had training, you've had extensive training. These techniques and this self-awareness, the hope is that you'll start using some of them on a daily basis. Not setting aside hours and hours, because you folks don't have that kind of time available to you. But even 3 to 5 minutes a day to practice or to think about some of the things that I'm going to suggest starts to make those exercises easier. And you find that over time, using these techniques changes your mood, and it can help to change your mood more rapidly than when you first start practicing these things. So without getting into the neurobiology, because I don't want people's eyes to glaze over and roll back in their head right now, learning these things creates a skill set that you can use for better self-care, and you can use in situations that are more stressful. And by so doing, what happens? You're less apt, number one, to develop depression. And if you do, it's probably going to be, it won't be as pronounced a case. So the first thing that I'm going to talk about today is something that in common parlance is very popular nowadays, and that's mindfulness. And you can think of mindfulness as training your brain to be present in the moment. There is a whole body of literature, Eastern thought, and meditation, and everything that gets very esoteric. But the simple way of viewing mindfulness and meditation is keeping your mind more focused on the present. The exercise that I always like to give out to my clients, because it's so simple, and it was one of the first exercises I used, was just the activity of eating. If you go to a movie theater and you buy a big box of popcorn and you're watching the movie, all of a sudden you're an hour into the movie or a half an hour into the movie, and that big mega tub of popcorn is gone, and you say to yourself, where'd it go? You weren't eating the popcorn mindfully. You were throwing it in your mouth. I do that too. And as a result of that, you weren't experiencing the popcorn. You were more focused on the movie. Just as in people's lives, what are we more focused on? We're focused usually on what's going to happen tomorrow, what's going to happen 3 hours from now, or what happened yesterday, or what happened 2 years ago. And so that present moment focus is something that most of us are not very good at. And as a result, we're trying to live our lives and deal with the issues that we have to deal with while we carry all this baggage from the past, or all this anticipation about things that are going to occur in the future. So just being aware of the fact that, again, we become, as Homo sapiens, we become distracted easily. And that in Eastern meditation, they call that monkey brain. I like that term, but we become distracted quite easily. And so mindfulness is, again, trying to focus on the present, on the moment, just as I'm trying to do in talking with you today. Focus on giving this talk, doing the best that I can. In meditation, there are some very simple ways to do meditation. And meditation is something that it affects your autonomic nervous system, and your autonomic nervous system is your brain and all the nerves that go into it. Actually, that's not true. The peripheral nerves are not part of it, but meditation is something that you can use to start your day out, to relax yourselves, to ground yourselves. And it's really quite simple. You've probably had some instruction in belly breathing, taking the air in through your mouth and filling up your stomach so that your stomach expands. And as you do that, and if you're comfortable closing your eyes, you close your eyes, You inhale a breath, you count 1, and then as you exhale the breath and you hold it for a second, you count 2. And you do that up to a count of 10, and then you start back over at 1. While you're doing that, that monkey brain that I talked about earlier, the thoughts will intrude. I have this responsibility. I have to do that. I have to go somewhere. Be kind to yourself. Quietly refocus again on your breathing, how that feels taking it in, how it feels filling up your stomach with air, and then exhaling on that 1-2 count. And that's basically a very simple primer in meditation. And you start out not by doing it for half an hour, 45 minutes, but 3 to 5 minutes in the morning. You make time for doing something. Now, the next thing that I'd like to talk about is 4 things that you can do if you're starting to maybe feel depressed. You notice that you have some of those signs that I talked about earlier. 4 actions that you can take to help yourself. The first one is real simple. Add a new behavior. A lot of, if you can. Now, when you're deployed, when you're involved in the military, finding time to do things is not always a simple thing to do. But as time permits, finding a new behavior, something that you haven't done recently, whether it's going to the gym, taking a walk in the park, just doing something new to change your routine. The other thing that depressed people experience many times is they start to isolate themselves. They start to pull away from family and friends. If people give you feedback telling you you're doing that, or you notice in fact that you are, it's time to start as much as you can. And sometimes it's very hard at first to reach out to people and to change that social isolation. And sometimes that's doing nothing more than, being in a group of people, taking a walk down the street, going to an outdoor cafe and sitting there and doing some people watching. That in and of itself can decrease your isolation. Change your thinking. We're all many times prone to negative thoughts. And if you're depressed, your thoughts are probably more negative than they normally are. You need to recognize that. And to some degree, make an active effort, even though it doesn't even feel like it makes a lot of sense, to reframe things more in a positive sense. You're having difficulty getting along with a boss. The boss doesn't seem to want to work with you on something. But rather than digging your heels in there, you say to yourself, look, how can I meet this person halfway? What kind of compromise or accommodation can I make to maybe come to some agreement with this person? It's not necessarily always easy to do, but again, you'll find that changing some of that negative thinking and will improve your mood. And then work at improving your mood. Try doing something charitable. It usually helps us feel better about ourselves. Find a buddy to go work out with. I've mentioned already meditation and mindfulness. Those things obviously really do help. But to get back to them just very briefly, there are things like that, and all these skills, it's important to note you don't use these skills just when you're feeling bad. You use these skills when you're feeling good, because when you're feeling bad, then they'll be at your disposal. If you wait until you're feeling bad and then you say, well, I'm going to go meditate, it's probably not going to be very effective. So again, you need to start using this stuff and incorporate some of this stuff in your daily routine. Now, when we talk about depression, we can think of depression, and I'm not trying to trivialize depression, because it can be very serious and very painful for the folks that suffer from it. But thinking about it in the sense of it's almost like the common cold. When we have a cold or when we're ill, we do things about that. And by the same token, when a person feels depressed, it's important for that person to do as much as they can do. And sometimes initially, that doesn't feel like a lot. Sometimes it's very hard to get going. That's, that's one of the symptoms of depression. You feel like your feet are stuck in concrete. So the first thing we try to do is good self-care, properly hydrate, get some rest, watch a funny movie. I'm an old geezer, so if somebody said watch a funny movie, I would say the Marx Brothers. Most of you are considerably younger than I am, so they're going to be comedians that you like to watch that you enjoy. But even that short distraction, that opportunity to laugh, even though everything else in the world may be going wrong for you, that does change your mood a bit. Eat properly. One of the things that caused me to pull my hair out, and you can see the end result of that, is that when I would work with veterans, I would ask them a very simple question, usually that first session that we had together, and I would say, can you tell me a little bit about your diet? What do you have for breakfast, or what do you have for lunch, or and when do you eat dinner? And it was startling. I don't want to say 75%, but it was pretty close to that of the folks that I work with said, oh, I don't eat any breakfast. And well, what do you have for lunch? Well, I had a candy bar. And I had a big dinner. That kind of schedule of calorie intake would cause anybody to be depressed. You've heard the expression garbage in, garbage out. If you don't have a proper diet, if you don't eat according to a reasonable schedule, and that means having breakfast, something anyway, it's going to affect you mentally. Why? Very simple. You wake up after a night of sleeping, your blood sugar is lower. So even taking some dry toast and orange juice or something like that helps you get over what they call hypoglycemia. Many people that have hypoglycemia, low blood sugar, experience a great deal of irritability and anger. So I had people saying, well, I don't do that. I don't eat breakfast in the morning. And I'd say, just try a little. They'd come back maybe a couple of weeks later, some of them, and say, yeah, I tried it. That's not so bad. So again, it seems like a simple thing, but self-care to somebody that's depressed is so important. Now, people that are depressed, one of the things, I'm going to mention some things that they do, and you'll see if you fall into or if you're experiencing any of these things. It doesn't mean you're necessarily depressed, but when you've got 2 or 3 of these things going, you probably are. Procrastination. The way to deal with procrastination, it's very simple. I used to have people come in and they would be procrastinating, and I'd say, well, what are you going to do about that? Like, use the example of cleaning up your basement. And they'd say, well, I'm going to clean up the whole thing today. Well, we all know that's not going to happen. That goal was too ambitious for the person. So I would say to the person, whoa, don't do that. Can you clean up about 2 or 3 square feet of that basement? And they, well, I could do that. That's no big deal. Please just do that. And if you feel like doing any more, I would say to them, stop. The next day, go back and do another 2 or 3 square feet of that basement. And lo and behold, eventually, a week or 2 later, the project is done. They can look back on it and feel good about it. Lack of self-care, we've already talked about that to some degree, just the basics. And one of the things there are 2 things about self-care that I think are really important. One is sleep hygiene, trying to get a good night's sleep. I'm not going to go into a whole big lecture about sleep hygiene right now, but creating an atmosphere, if you can, where it's easier for you to sleep. Not playing video games 5 minutes before you go to bed. Not drinking alcohol just before you go to bed. Things that will help you get a better night's sleep. That's a real good treatment for depression. If a person has no focus, and again, this sort of ties into the whole procrastination thing, what can you do about that? Well, start by getting yourself a calendar. Start by making a little list. What I found with many of the veterans that I work with, what they did was they'd make these big, long lists, and then they'd come back in and they hadn't done everything on their list, and they'd beat themselves up. Well, I didn't do everything I had listed there. And I'd say, well, how many things did you have listed? And well, there were 10 things on the list. No, start out with a list of a couple of things that you're going to do, and keep it at that to begin with. And finally, one of the biggest thing and the easiest thing to identify is just a negative mindset. Your worldview is negative. You don't want to be around people. What can you start to do to change that? Something very simple, like walking down the street and just saying hi to people. I tell the story. I worked with a veteran several years ago who was a carpenter, and he would go to the big box stores. And he told me that one of the things that he liked to do was to recognize if somebody was helping him, if one of the sales staff who was helping him was especially helpful, he'd ask them to get the manager. He said they always had this look of fear and trepidation on their face because they thought he was going to make a complaint. And then he would compliment the sales clerk. He'd give a compliment to the manager as to the kind of help he'd received. The last fellow they told me about was he'd done that for a fellow vet, and the joy that it gave the salesperson and the joy that it gave my client, you could just see in the smile on his face. So doing little things like that can change, even though things in your life aren't very good at that moment in time. That momentary change, those momentary good feelings can start to change how you feel. How do you respond to other people's depression? Most important is you listen without being judgmental. You just listen, and there'll be a voice going on in your head that wants to judge. You could do this, you could change that, you could pull yourself together. Quiet that voice in your own head and just listen to the other person. How often in our lives does the person sitting across from us actually listen to us? That's a rare skill. I've been in mental health many, many years, and I still struggle with being a good listener. So that's really important. Sometimes listening and not giving advice is the best thing that you can do. In helping people who are depressed, it's not your job to fix the other person, but sometimes just listening shows them that you care and that they don't need to experience shame, and there's somebody present for them. Also, many times when people are depressed, they present, as I said earlier, as quite angry. Whatever you do, don't personalize that anger. Remind yourself that other person is struggling, so I'm not going to personalize this. And if those things aren't helpful, then maybe it's time to encourage that person to seek help. Now, let me mention in talking about suicide, let me mention some myths. The first and most prominent one is talking about suicide can trigger it. That's simply not true. Talking about suicide takes the shame of it away and starts to open a conversation that may save that person's life. The second thing is, if a person is determined to kill themselves, you can't stop them. That also is not true. Many times that person may have ongoing suicidal ideations or suicidal ideations that come and go. But getting them over that rough period may be just what they need to get beyond that. And finally, people who talk about suicide aren't really going to do it. That is not true. If people talk about it, you need to take that seriously. Now, people that are thinking about suicide may, in fact, not only be dangerous to themselves, but they could conceivably be dangerous to you as well. So first and foremost, consider your own personal safety. Helping others doesn't mean jeopardizing yourself. So again, if it seems to be beyond the scope of what you can do, calling 911, calling the suicide hotline numbers that I'll give you later, do that and don't put yourself in any kind of jeopardy. And have you ever, this is a question that I like to ask, have you ever not said something because you didn't know what to say? Sometimes it's important to acknowledge that, to see another person struggling and to say, I'm not sure what I can say to help you, but I'm here for you. Sometimes that's enough. Don't worry about coming up with the perfect answer. Just your being there, you're expressing interest, and again, that listening that I talked about earlier so often is what's the other person's need, what the other person needs. There are two numbers now that I'd like to give you that are very important. One is the National Suicide Prevention Line, and that number is 1-800-273-TALK. That's 1-800-273-8225. And the other one is the American Red Cross Hero Care Center, and that number is 1-877-272-7337. If you call those numbers, you're going to get an answering service, or you're going to get a recording, and you're going to be asked to leave a message. Leave a message, and someone will promptly call you back. Now, having said that, there's always the outlier case where you don't get called back promptly. Don't be patient. Call back again. I can't emphasize that enough. Now, there are a few things, again, to go over with the person who is struggling with suicide. Ask directly what's going on. Keep them safe if you can, but certainly don't put yourself in jeopardy. Be there for the person, and sometimes that means just sitting with the person. Help them connect. Hey, here's a number. Here's that suicide hotline. And then reconnecting up with them the next day. Hey, did you call that number? What was the effect? Did you get through? How you doing today? That follow-up is so important. Now, in the time we have remaining, I'd like you to do one thing in the next 3, 4, 5 hours. I'd like you to think back about this talk. I know I've said a lot, but maybe there were a couple of things that resonated with you. What were those things? And I'd just like you to sort of rehearse them or think about them in your mind for a second. The purpose for me doing this is you're more apt to take something away from this talk if you give it 2 or 3 minutes of reflection a few hours from now and think about it. And if that particular little bit of information thereafter gives you some insight down the road and helps you or your family members, then I've accomplished my task today. In closing, again, I want to thank you for your service. I want to thank those folks in the military that are listening to this, and I want to thank their families who support our men and women in the military. Obviously, there's a great deal of personal sacrifice there, and again, the Red Cross and I appreciate that. And I'm just trying to give a little back out of appreciation. So I wish you the best. Thank you for your forbearance. Take care.